Welcome to Season 4 of the Dr. Youn Show. This episode is one that I have been waiting to do for literally years. I'm going to be joined by one of social media's most famous and popular plastic surgeons, Dr. Subbio. So I'd like to introduce my guest this week. Welcome, Dr. Christian Subbio.
You're too kind with your introduction. I'm not social famous. I got like 1/10 of your followers, but you're too kind.
Well,
Thank you.
If you talk to anybody who's in the field of plastic surgery or dermatology or really any type of cosmetic medicine, they all know about Subbio. And it's not even Dr. Subbio. They just talk about Subbio. So I'd like to start off by really explaining that, for those people who haven't heard of you, you are known in plastic surgery honestly as a bit of a maverick. You go out there on social media, you tell people really the way it is, things that maybe some plastic surgeons aren't telling you because they have, I guess, monetary reasons sometimes not to. And you don't worry about consequences even from your own peers. So I'd like to start off by asking you to tell us your story as a plastic surgeon.
As a plastic surgeon, let's go way back at this point. I guess, I knew I wanted to be a plastic surgeon when I was 16 or 17 years old. So before I even went to college, I was kind of wrestling with, do I go to art school or do I do something else? Because I've always loved painting and drawing and creativity in all its forms. But later in high school, I was kind of listless. I didn't know what I would do with that. I just had no aim, no goals. And I was kind of good at science as well. So I thought, hey, wouldn't that be cool to do art in the form with the human palette? It sounds corny, but that's what I was thinking at the time.
Yeah.
And I really had no idea what I was getting into. My parents both didn't go to college. We had no doctors in the family.
Wow.
So I'm like, yeah, that sounds like a cool idea. I'd like to be a plastic surgeon. No idea. I had no idea the path that it would take, how long it took.
Yeah.
And you know better than anyone else. But, so like 15 years later, get to point B. I think I had a bit of a professional disillusionment, we'll call it, because after 15 years of pre-med, medical school, grueling surgical residency, plastic surgery residency, 100-hour work weeks, you know the deal. There was no time for art or creativity whatsoever. And by the time I got to point B and I was an attending, I reached a point where I'm like, oh my God, I'm at point B. And I'm unfulfilled. I haven't picked up a paintbrush.
So you finish your residency, and then do you go into private practice right away, or do you join somebody, or
I worked for a hospital group for about 3 to 4 years.
Oh, wow.
I was doing lots of microsurgery. So these are the, as you know, the 12-hour cases, bilateral breast reconstructions, transplanting tissue, suturing vessels under the microscope, hardcore stuff. And but left no time whatsoever for any creative pursuits outside.
And so at that time when you were, a academic, essentially, or a hospital-based plastic surgeon, did you find that to be quite stifling? I was. Were you not happy?
No,
usually you finish your training and it's like, thank God I'm not in training anymore. I'm a real plastic surgeon, and you go into something that just was not fulfilling to you at all.
It's funny, and you can imagine how disappointing that it is. Like 15 years after deferring like your creative dreams. And then you get there and you're making good money out the gates. I'm starting to pay back my loans, but I was not, money is not my motivator.
Yeah.
I was creatively unhappy. And so that's when I kind of pivoted and,
So you went and started your own practice. When was that?
It was, like 10 years ago now. Yeah.
Okay. And then did you start it by yourself, or did you have somebody else?
Yeah, just hung a shingle, just me.
Wow.
Sitting around waiting for patients in my exam room,
How long did it take for you to get busy to really start making
this is where I credit
living?
Social media as really helping me ramp up a lot quicker than I otherwise anticipated. I thought it would take, 5 to 10 years before I was somewhat busy. And this coincided right around the time that social media, Instagram in particular, was taking off. And I leaned into that, and that changed my practice altogether. I got busy within maybe like 2 or 3 years. So it's been an incredible gift for my practice.
At what point did you decide to kind of buck the system and really put your personality out there? When we all look at plastic surgeons who are on social media, and what do? They put before and after photos, they explain procedures in detail, but you do a lot of other things on social media. When did you make a conscious decision at some point as a doctor that, hey, I'm not going to do what everybody else does? I'm going to do what I want to?
Yeah, it's fun. It's a great question. And I remember the exact moment. I give talks on social media sometimes at meetings and stuff, and I always talk about this one moment. I was at a meeting, I think it was Vegas Cosmetic, and I was in the business track, and I was listening to some speaker talk about branding and marketing, stuff that I always find interesting. And he was like, the power of being yourself, your authentic self. And at the time, no one, doctors were doctors. They were buttoned up, stiff. And that's how I was advertising, talking about breast implants, showing it very clinical, very dry, what was expected of us. And this presentation was about like, look, be yourself. And that was an aha moment. I was deeply unhappy professionally. And I'm like, you know what? F it. I'm going to be myself. I don't take myself too seriously. I enjoy humor. I'm a kind of goofball a little bit. And so I started leaning into it, fully expecting that I would lose patience, that it would be professionally a bad move. And much to my surprise, it was quite the opposite. I found that people loved it. And at the time, at least, not many people were being authentic. They were playing the role of what they thought a doctor or plastic surgeon should be. And once I started bucking that trend and, cussing a bit on Instagram, doing funny, silly videos, showing my art, people loved it, and it was amazing. Within 6 to 12 months, 75% of my new business was from Instagram. And a couple months later, almost all of my patients were coming from Instagram. It was an amazing aha moment for me.
So you're happily married. You've got a beautiful wife, Jillian.
Yeah.
At any time when you started putting this stuff out there, you say, hey, I'm going to cuss and stuff. Did she say, hey, husband, are you sure you want to do this? Or maybe this isn't a good idea. Did you get any pushback from your wife?
Well, I got pushback from everyone, but my wife in particular, she was, she's an attorney by trade. She's, of course, very cautious, and rightfully so. You can get yourself into some trouble. So she still functions as my go-to to check things. Hey, is this a bit too far? And she's a great litmus test for whether or not I've pushed the envelope a bit too far.
So you created some iconic videos over the last, how long have you been on Instagram? Maybe 10 years?
8 years, probably 7, 8 years,
So you've created some iconic videos, and a lot of people know you by this nickname you've given yourself, Tuck Daddy, okay? And you cavort around wearing big chains. You look like a 90s rapper. You've got a fur shawl on. How did you come up with the idea of Tuck Daddy? And at any time, did you think that it was going to go viral and that people are going to really know you by that? To the point where haven't you trademarked the name or something?
Trademarked it, yeah. I still feel so stupid saying that, but yes, like many things on social media or creativity in general, it's just an random idea one day. I'm like, hey, and I did an Instagram poll. Hey, what should I start calling myself? It was a fun idea, and it was like a couple different options, both equally, all ridiculous. One of which was Tuck Daddy, and it got 80% of the votes. I'm like, hey, let me make a funny persona, thinking I just do one video. And so, like you said, kind of getting this ridiculous get up, like a rock star rap star, like a fur coat, and it's I started making videos in this persona, and people loved it, and eventually the name stuck. And it's interesting because I'm well aware that you have to ride a fine line. You can't just do goofy stuff all day. You have to walk the walk. You have to back it up. So it's that is the dance, as you well know. You dance that dance as well, quite well, I might add. But finding the line between humor and entertainment, but also credentialing yourself as an expert who's serious when it comes to being serious and delivering results.
So, putting videos out there as Tuck Daddy is something that, as you say, you're kind of riding the line. At some point, people would consider, that you may be unprofessional. And there's this term, unprofessional, like who's professional, who's unprofessional, and who decides what that is. Have you had pushback that you know of from other plastic surgeons that have either talked to you, they have taken you aside, say, hey, you got to, quiet things down, people are talking about you, or anything like that?
That was more in the early days, I think, when, it was a bit more jarring to see someone not in the white coat talking as a doctor should talk. But number one, I just don't care what people think to a great extent. And it allows me to be authentic and not just, following some script. I just don't care. And I think people, as soon as they realize that you don't care, you're going to do what you think, is authentic, they'll stop talking, especially when they see you enjoy some success with it, which I know you've experienced as well. People see your social media account, and you don't take yourself too seriously, which is great. But people who think they have to still act like that 1950s, 1960s doctors, that really gets under their skin because they see someone like yourself bucking that trend and doing quite well at it.
Do you ever go to meetings, and are you ever nervous as far as who you might run into if has anybody ever come up to you like a old school plastic surgeon and said, I don't like what you're doing or something like that? Or has it really pretty much been very positive?
It's generally been a positive experience. And if anyone is talking smack, they're doing it behind closed doors, or the routine. They'll fire comments from their troll account, but no one, by and large, good. It's funny. The plastic surgeons that would have been complaining about this 10 years ago, the big time academics and the very serious buttoned up types, now they're all on social media.
Yeah, now they're lip syncing to TikTok videos too.
Exactly.
But so they don't get the followers and the counts, the view counts that you get.
Because it's not authentic,
Yeah, true. So today's topic is lifting the curtain on what's wrong really in plastic surgery today. And one thing I admire about you is that you have been brutally honest about a lot of things in our field. And you will say things that may upset people, but it's always from a place where you want, number one, patients to always be treated professionally and appropriately. And number two, you want to call out some of the BS if it is harming patients or if it is being disingenuous and maybe wasting patients' money and things like that. So I'd love to start out with you talking a little bit about our conferences and our societies. And what do you feel is going right as far as our societies today, and maybe what may be going wrong?
I think with the societies, when they are fighting the good fight of trying to raise the standard of the practice of aesthetic medicine, that is when they are doing their best. Mm-hmm. That's when they're doing God's work, because aesthetic medicine is rife with snake oil. For those of you who don't know, snake oil was an actual thing in the late 1800s, early 1900s, where, traveling medicine shows people selling oil with a little pepper in it. You rub it on your knee, it'd get warm, and people will tell you have a miracle cure for everything. But aesthetic medicine these days is just that. It's filled with snake oil. So when our societies are raising the bar and making sure that there are there's some hoops to jump through to become a plastic surgeon, to become an injector, to become an aesthetic physician, that is when they are doing their best work.
Do you have an issue with the societies having so many supporting supporters as far as an industry where they help pay for our conferences and they pay for research and on their products, and sometimes they pay hundreds of thousands of dollars to certain plastic surgeons to write about their products and to lecture about them? I mean, does the conflict of interest bother you that we see so much in our field?
It bothers me to an extent is unhealthy, probably, because money, of course, is the root of all evil, but the way it has infiltrated all specialties, ours included, is quite concerning. There's actually been papers in our own journals documenting this. I won't name companies, but certain companies are dumping, they did one study that showed, I think it was like 60% of speakers at that meeting were on the payroll of the big companies. And this is where it really does matter. If I'm in the audience, I'm there as a surgeon. I want to learn the best techniques, the best products to bring back to my patients. I want to know transparently if that speaker is receiving, like you said, sometimes $500,000, sometimes up to $1 million for research or advisory boards, et cetera. This field is rife with money exchanging hands behind the scenes, and we need a good dose of transparency.
Yeah, I think that there are two things for me that I see that bother me when we're talking about this type of a subject. I mean, the first thing is that you have certain plastic surgeons and dermatologists, just doctors overall, who are so working together with, let's say, device companies, that every device that they come out with is like the next big thing. And they do studies for them, and the studies always show a beneficial result. And sometimes it's like a fad procedure. So a good example of this is laser liposuction. Many years ago, every laser company developed their laser lipo because it was the hot thing at that time. And then there were studies being performed by plastic surgeons, dermatologists who are on the payroll of these companies showing, if we laser lipo, you could see how that skin retracts and it tightens and you don't need a tummy tuck anymore. Laser lipo is going to do it for you. Then the laser lipo loses popularity, and then 3-4 years later, they're on the next treatment that same company has come out with. And now they're doing studies on that. And we see the same doctors presenting for the same companies over and over and over again. And the other thing that bothers me too is I do think that there are doctors who they take such pride in presenting at our meetings. It is an honor to present a paper. But at the same time, if you have a technique that is tried and true and it's worked for you for 15 years and your patients love it and they're happy with it, you can only present that once. And doctors who want to be on the podium and present over and over again have to present something new, because you can't say, hey, you know what? I do my blepharoplasty like I did for the past 10 years and my patients are happy. Then there's nothing to present. So they have to say, oh, I'm doing this differently this year. And then the next year they're doing it differently, and then differently the next year. And in the end, it's like, why are you even changing it? Because either it's the same procedure, or now you're doing things that may be harmful to the patient just as a way to do something differently.
Yeah, that need to stay relevant. It's an opiate for sure. To your initial point, these devices that this strikes close to home, because I bought a few of these devices, and for those of you who don't know, these devices cost like hundreds of thousands of dollars for your practice. And I'm still paying the loans off on some of these, and they're sitting in my basement because I went to some big traveling show where the same doctors, they're always up there. They're very charismatic. They know how to sell these things. You buy them. First it was laser lipo, and then it was ultrasound, and now it's radio frequency. All these things, nothing tightens skin. But you have these doctors, and you don't know it when you're young and stupid like I was. You go to these things, they're up on stage. You don't know that they're receiving hundreds of thousands of dollars every year from these companies. They're getting hundreds of thousands in free devices. They're getting stock options. They're getting wined and dined, flown around the world, treated like some rock stars. And all the while, they're selling you these treatments that they are writing the research for that ends up in the journals.
Yeah.
And so the money is coming from, and then the meetings are supported by these very companies.
Exactly.
The money is being thrown in all directions, and you cannot trust anything. So I hate to be overly cynical, but I've been burnt, and I hate. It's like nails on a chalkboard to me. People lying to, especially uneducated people who are not educated in this particular thing. I hate when people get swindled. It is a passion of mine to debunk these. And so it could be my colleagues who are buying these devices. You mentioned earlier, like people, not only dangerous devices or dangerous treatments, but wasting their money. Some of these people save up. They don't make a lot of money, and they're saving up all year because they want to look and feel their best, and they dump $3,000 into some latest face tightening procedure that just doesn't work, and it really, really bothers me.
Mm-hmm. You just actually completed your 3rd annual Needle Art Conference. Can you tell us a bit about this conference? This is a conference for quote-unquote disruptors.
Yeah.
So I know you're proud of it. Tell us a bit about it.
Yeah, I mean, it's our 3rd year. It may be our last. I don't know. People are clamoring for another. It's just a conference focused on non-invasive, non-surgical rejuvenation techniques, particularly injectables like toxins and fillers and biostimulators, et cetera. So it's for nurses, PAs, doctors, people who want to learn injectables. And what I pride myself about this meeting is it has very, very limited industry support. Again, most of these meetings are infiltrated. You go to them, and every speaker is up on the podium, and it's a commercial for product A. Next speaker, commercial for product B, and so on and so forth. The breakout sessions are all everything is sponsored, and you cannot trust anything. Everything is tainted with money. So what I like about this conference is we really just focus on good technique, good science, without all this industry bias tainting everything.
Why did you decide to start your own conference?
I love teaching. I mean, if I could do it all over again, I might go to film school, or I might try to do something creative. And now that I'm so invested in, and I do love my field. I love what I do. I love interacting with patients. But to scratch that itch of wanting to do something creative, social media is one outlet for that. But the other is these conferences, because I get to make PowerPoint presentations and my illustrations, et cetera. It's an outlet, creative outlet.
It used to be that 20 years ago, the main meetings across the country cosmetically were from just the societies. It would be the American Academy of Dermatology, or the American Society of Plastic Surgeons, or the Aesthetic Society. And now there are independent groups that are having their own meetings. Some of them are getting quite huge. You've got Needle Art. Have you had any pushback for you starting your own conference from people maybe who are heads of societies, because they are threatened by the fact that there are these independent meetings out there? Or have you not heard anything?
I've not. It's been a generally overly positive experience. And if anyone did ever come to me from a society saying, we don't like you having your own meeting, I would say, well, then do better on your own. Make it more, it's a free market of ideas,
So you're huge on social media. And as you mentioned earlier, you like to call out the BS on cosmetic medicine. I'd love to ask you, how much of what you think cosmetic doctors say on social media do you think is actually BS? When you follow people and stuff, do you think that there really is a lot of BS out there? Or do you feel like it's more just that kind of minority, that type of thing?
It's half and half, I'd say. It's hard to quantify these things, but for everyone, honest, authentic, smart doctor or nurse out there teaching on Instagram, there's probably, I don't know, 2 or 3 or 4 who are just full of it and promoting pseudoscience, because it's so easy in these 30-second or 60-second clips or on these photoshopped or favorably lit before and after photo. It is so very easy to fool people on social media that I just don't have the time in the day to debunk everything I see.
Yeah. What can you name something on social media, let's say a treatment or something that you see advertised a lot that you think is BS?
I think all things claiming to lift faces that don't involve surgery. And people will say, well, you're a surgeon, you just want to earn. No, I don't do facelifts anymore. I would love for there to be a laser or device which actually tightens and lifts a face. Anyone would love it. If someone invented it, it would sell like hotcakes. But instead, what we get is these half-baked ideas, half-baked research with these devices from these people being paid to promote them, just like we said. There exists no such thing that is going to lift one's face apart from surgery. And I've tried them all at this point.
You also injected half of your face with neurotoxin to try the Nefertiti lift.
Yes.
So the Nefertiti lift, if you have followed my podcast, I think Dr. Levitt and I covered the Nefertiti lift on Hot Topics several weeks ago. And the idea behind it is if you inject Botox or any neurotoxin kind of along the jawline, the idea is that you can counteract the neck muscles that will basically pull the skin down. And so by counteracting those muscles, people claim that they can get a non-surgical lift of the face. And so you, taken upon yourself, did some self-experimentation and you injected the Nefertiti lift on half of your face. And then you went on social media, you made some faces so people could see how much you moved and asked which side you had it done. I never saw the results.
Neither did I.
Did the Nefertiti lift work for you? Were they able to spot which side you had done?
No,
first
they
of all?
could not tell. I mean, let me qualify one thing, because admittedly, this is me. I had one of my nurse practitioners inject my face. This is not a scientific study befitting one of the journals. So people are quick to point that out, and they're right. But I will say there is also no good evidence that shows, no good studies out there that show these techniques actually lift a face. And that is not to say that they don't have some effect or some benefit, especially in the properly selected patient. And there's these people out there who they have their face puckers, they have a resting tension to their face, their neck is a little bit scrunched, they're tense. In those people, relaxing their lower face and neck with toxins, it will have a rejuvenating effect. It might perceive as a lift, but it is not lifting, and therein lies the rub. I mean, because people will take a claim like, oh, it lifts, we're going to sell it as a lift. This will replace, it'll give you 30% of a facelift. No, it won't. These words matter. You have to be very precise with these ideas you're selling on social media.
So if you had to pick your favorite neurotoxin, what would that be? So just to say there, for those listening, what are the neurotoxins that are FDA approved? It's Botox, Dysport, Xeomin, Jeuveau, and Daxxify. And I'm sure you've used all 5.
Yeah, I have. And again, this is not scientific. To an extent, I mean, there's some value in me saying I've used all 5. I've done tens of thousands of injections, as have you. And my preference is for Dysport. And people will be quick to say, well, what about, look, I use different toxins in my practice. There's certain toxins that work better for other indications, but by and large, and I just did a post on this, polling people, if you had to pick one toxin, my favorite of them, if I had to take one to a desert island, it would be Dysport. And that's what I found on my survey as well. 65% of people, more or less.
What do you like about Dysport that sets it apart from the others?
I like the company that produces it. And again, I have spoken for them, so take this with a grain of salt. This is important disclosures. I have spoken, once in a while, I'll get a little bit of money to speak for them, so take this with a grain of salt.
You haven't bought your house off of the money from Galderma. I'm joking.
You know what I'm saying? It's like,
and everybody, you can look this up.
You can.
The Medicare website, you can look up how much doctors get paid by different companies.
Sunshine
so if
Act.
you want to check out Dr. Subbio,
Very
you can see
interesting.
how many millions of dollars that he makes from industry, and then you'll see how many hundreds of dollars I make from industry. No, I'm joking.
I would encourage people to look. If you could put a link on that, it's very interesting.
Yeah.
I think last year I got 10K or something. And for context, my overhead of my practice is like 7 figures. So when I say, what was the question? Oh, why do I like it? Because
why do you like
I like the
Dysport?
company. I think it's a solid company who runs their company with ethics. It has a rapid onset. It has a more diffuse spread, which is good in most situations, not all. And I think it's a little bit more bang for your buck. It's a little bit more potent what you get in the vial. And that bears out. Most of my colleagues with whom I speak about this agree with that.
Yeah. So we have Dysport here. I like Dysport. I agree with you completely in that I feel like Dysport gets you a bit of a softer result. I feel like Botox gets you if you have somebody who says, look, I want my forehead frozen, I don't want movement at all, then I would go more towards a Botox. I do think you get more of that type of a freezing effect. But I do agree. I feel like I get a bit of a softer effect with Dysport. I do love Dysport as well. Lately, I've done Daxxify. I actually had it done here. And I did find that Daxxify worked more quickly. Like Botox and Dysport takes me at least a week for it to start taking effect. And I found Daxxify was 2 to 3 days.
Yeah.
But initially, they came out hoping that it lasted 6 months, and more refining that it may last longer than the other ones, but 6 months is probably unrealistic for most people.
My personal opinion is they put the cart before the horse in the selling, in the rollout of that particular drug. Yeah. I think it is important to point out to people that, look, we all have our favorite toxins, but they all get the job done. You might need to do a little bit more of A versus B or C versus D. In the end, if you dose properly, all of these will relax your muscles. They all work to some degree, to a great degree. So they're all good products.
So you do a lot of injections. Most people who listen to this podcast, watch this podcast, know that you can inject your forehead wrinkles, you can inject your frown lines, you can inject your crow's feet. Are there any areas of the face? We talked about the Nefertiti lift where you injected around the jawline. Are there any parts of the face that you find kind of uncommonly that you inject, but you really find a nice result from that?
Yeah, I mean, it's not rare, this indication, but the chin, it's one of my favorites because I think a lot of people, as I just mentioned, have that lower face tension and they scrunch the chin. It gets this unsightly dimpling. It has like a tense, look. To have your lower face pursed, it just has an unpleasant emotional
it's
quality.
A golf ball chin.
Exactly. Yeah. So, it's one of my favorite treatments. You give 5, 10, 15 units in the chin and it'll relax. It really softens the lower face.
Have you ever had anybody who had issues with the movement of their lower lip after injections in the chin?
Sure. I can count on one hand, to be honest, but you get more in. Actually, I don't even think of the chin in particular when trying to treat the DAO. Just adjacent to that, I've had a few patients over the years who have had some weakness on one side that you then have to correct by balancing the other side. And that's very important as well. If you ever hear injectors talk on social media or podcasts saying, oh, I don't have any complications, they are lying. If you inject enough, if you've done thousands of injections, you have made some mistakes, or you've had some patients who have had an unpredictable result. It's very important that people be honest about the risks of these things. They're quite low, but they're there.
All right, well, let's switch over to fillers. You've used a lot of different fillers in your career. If you could pick one favorite filler brand, what do you think that would be? Not saying that any other ones are bad, but if you could pick one and only use, let's say, one brand for the rest of your career, what would you pick?
Okay, and I want to be very transparent here because I'm speaking for this company. I always speak for two companies. Mind you, you might hear this and think I'm speaking. I only speak for two companies because I really don't want to whore myself out to the industry. So, but that's why I'm in town.
Yeah.
To visit you and to speak for this one company. It's Prelenium's Versa is, I think, I think it's coincidental. It's a very versatile filler. I use it on nasolabial folds. I use it on medial folds. I use it on cheeks. I use it on temples. It just can be used all over the face. So I don't mean to shill for that product whatsoever. Much like toxins, all the gels are good gels. It just depends on their pricing point, and some companies are reasonably priced. Like I believe Prelenium reasonably prices their product versus some other companies where it costs literally 3 times as much for an effect which I cannot perceive as any better. So in the end, I want to do. These are expensive things. So if the company is charging less for a product of equal value and equal efficacy, I'm going to use that. It means I could use more from my patient. So
I've never used their product before. Can you tell me what sets their product apart from some of the other ones on the market, Restylane and Juvederm and stuff? I mean, it's an HA filler, right?
Correct. And that's why I don't mean to or intend to act like their filler is better than any others. I'm someone who's very clear. Even when I speak for them tomorrow, I'll say, look, I don't think this is there's anything special about this gel. I just think it's versatile and it's reasonably priced by a company that works with ethics, works ethically. So it just works in multiple areas. So if you have one syringe, and you also get 1.2 cc's in the syringe as opposed to a little bit more, it goes a long way.
Yeah. So the average, most companies have 1 cc in the syringe, so they give you 1.2, and I mean that's 20% more, which is, hey, that's not a bad deal.
Not bad, yeah.
So what is your favorite place of the face to inject filler that you find it's most powerful? So obviously everybody is different in what they can, and what type of benefit they may be looking for. But in general, when you're doing filler, what are some of the most powerful areas that you like to inject that you feel, hey, I'm going to do this, they're going to get a great result from this, they're going to be real happy with it?
And this is a difference in philosophy. There are plenty of people out there who say, look, start laterally, frame the face. This is going to lift. It does not lift. It's going to reposition or structural support. They use all these big fancy buzzwords that don't mean anything.
Yeah.
So for me, especially because these are expensive products, many patients can only afford 1 or 2 syringes, in which case I find that the most powerful place to inject is the lower central face, i.e. the nasolabial folds, the marionette lines, chin lines, shadows in this area, jowl, etc. Because if you ask me, this is where the signs of aging manifest most powerfully. What does your face do? It drops and deflates. And so how does that manifest? As in shadows on the nasolabial folds and the marionette lines. So injecting, that's how I view filler. It's not rejuvenating. Botox, toxins do not rejuvenate. They paralyze muscles. Fillers do not rejuvenate. They're injecting 2% sugar jelly into your face. But what I do think these things do is camouflage the signs of aging if done conservatively. And that is the important point, conservatively.
That's interesting, because I would have had the opposite reaction in that my favorite area to inject would be kind of the cheekbones and and the anterior, the front of the cheeks and all that, because I feel I can get such a nice change overall. I feel when I inject the lower face, because there's always laxity involved, the skin is a bit loose essentially, and I'm more often disappointed with what I can do with filler because I know that what they truly need is going to be an actual lift. So I find that interesting because if I'm disappointed with the result of filler that I've done, typically it's in the lower face. So I'm always a little more conservative there. And it's like, are you sure you want to do that? It may or may not give you the result you're looking for. Whereas when I do the cheeks, I feel that, okay, I know exactly what I can get for them. So yeah, I find that interesting because I think we have 2 different opinions.
Yeah, and there's different philosophies, different approaches. And we should make certain that we explain that every patient is different. A lot of these companies, when they do their trainings, they will literally have you draw grids on people's faces.
Do the exact same thing on everybody.
So, I could use...
That's a good way to start for somebody who's never used a product before, but you hope that, a couple years later, they're going to be able to, kind of get it.
This is I'm not a fan of starting people. Yes, I believe these grid patterns and these codified systems are all designed to sell fillers to new injectors. Which, look, we all got to start somewhere. Yeah. But the analogy I make is, there's no grid or code or pattern that teaches you how to do a facelift, right? No. And they don't let our surgical interns do. No, this stuff is dangerous. It requires years of training. So I'm not a fan of the, let's make it easy. I want it to be hard. I want them to have to rise the ranks, in the apprenticeship model.
That makes sense, yeah. So is there a part of the face that you are not a fan of injecting filler that maybe people do too much of?
Yeah, there's so many. People do overdo lips.
Anywhere you do.
Correct.
But is there a part of the face you feel that maybe filler isn't the best thing?
Yes. In particular, and this is a bummer because the tear troughs, I could use something done on my eyes, like the shadows in the tear troughs, the bags under the eyes. And it's one of the first things that people notice that makes them feel that they're aged. So, of course, they're going to come, hey, can we circumvent surgery? And some of the companies sell this as, quote, blepharoplasty in a syringe, which to me is preposterous. When it works phenomenally well. But any injector who's being honest with you will tell you that it has the highest rate of complications. Yeah. This area is the thinnest skin in the body. It's notoriously poorly drained lymphatics. Yep. So now you're putting a gel in there that pulls water in and gets bluish discoloration, and you can see it across the room. You've seen these patients, they come in, hey, I'm here for somebody, and you're looking at them like, oh, have you had filler in this area? Yeah, I did. When? 7 years ago. This stuff lasts a long time, not the 9 to 12 months that they tell us.
So do you do under-eye filler injections?
I will in the appropriately selected patient, number 1. Number 2, in the conservative amounts. And number 3, slowly over a couple of visits. There's no rush with this. This is cosmetic stuff. This is a luxury. It's not, they're not going to die from their tear trough bags. All right. So I'd much rather do a little bit, bring them back a couple months, do a little bit more and walk towards the goal instead of a full out sprint.
Do you have fillers that you are that are kind of like your go-to for that area?
For that area, I typically prefer Restylane L. I'll usually dilute it with a little bit, and this is stuff that a nuance that people do differently in their own.
So you'll dilute that down a bit,
a little bit. So
really?
I'll pre-hydrate it so it'll pull less water into it. And then again, there's the counter argument that changes the characteristics of the gel. So another reason to be conservative with that.
Thoughts on PRF? I've been hearing a lot of people lately saying, oh, PRF is a good quote unquote filler for the under eyes. Yeah. My understanding is PRF you've got to do once a month, probably for 3 to 4 treatments, which, I mean, that's a lot for somebody to go through, especially if you get bruising in that area month after month after month.
It's pricey too, right?
Yeah. Have you tried PRF under the eyes?
We offer it. And like many things, I offer it, but I explain it in a very sober fashion. I think the problem with PRF is people way overestimate and oversell what it's going to do.
Yeah.
It is certainly, like you said, not going to replace fillers in the under eye. It is not a volumizer. It is growth factors.
Some people are claiming that it is.
No, I mean, like, if so, it is quite subtle to the point where you're squinting your eyes. And for me, if you're spending $1,000 on some treatment and it's like some photo hunt at a bar and you're squinting at the before and after, trying to perceive the difference, that is not a good treatment. So I use it more for improvement of skin quality. You have to do a series of treatments, but I really kind of underpromise in that realm. I say, look, this is going to be a very subtle result. It may cost you a couple $1,000s by the time you get there. So, just everything with a good head on your shoulders.
So for those of you who are watching and listening and you're like, what's PRF? Is that PRP? So it's not. So PRP stands for platelet-rich plasma, and essentially we draw blood, we spin it down, remove the platelets. The platelets are filled with growth factors, and we take that platelet-rich plasma and you can re-inject that into the patient. You can do that into the scalp to help with hair loss. Some people inject it into orthopedic areas and stuff like that. PRF is platelet-rich fibrin, and it's very similar to platelet-rich plasma. The main difference, my understanding, is that when you spin that blood down to remove the platelets, you spin it down much more slowly, and the idea is that you keep more of the fibrin and substances that you would otherwise have spun out before. And then the belief that some people are sharing is that if you take this PRF, that because it's not as thin as PRP, it's got more in it, that it can actually act as a filler, which you're saying that you don't believe that. And and for me, I find it hard to believe as well. Back when PRP first came out, there was a company that we worked with, and I purchased some of the products from them called Self-Fill. And when you think Self-Fill, and it's not spelled SELFILL, but the company is named Self-Fill, they're still around. The idea you would get from that is that it's going to be a filler, self-fill. It comes from your own body and it fills you. And so once that came out, we started injecting it. We injected under the eyes and other areas, and we were under the impression that it would act as a filler, and it just didn't, which makes sense because your blood is not a filler. You have blood that courses through your body, and if you take your blood and just inject it into a part of your body, it's not going to act as a filler and stay there.
That's a good point, yeah.
It just doesn't make a lot of sense to me, but there are people who are saying that PRF is an alternative as a filler for the under eyes, which you're saying that's BS.
Show me standardized before and after pictures and show me a bunch of them. This is a perfect example of people overestimating and overselling things. And this is, to your point before, this is what some young teacher who's saving up a couple $1,000s and putting high hopes in you brightening her eyes, she's going to be sorely disappointed if that's what she's expecting.
So you mentioned that you have purchased devices that may be in your basement, that ones that you could still be paying off. Can you name maybe a treatment that didn't live up to the hype that may or may not be used even today?
Without naming name brands, because we want to keep free.
But we can say what type of a device it is.
I mean, I think the radio frequency, all things radio frequency, I think are oversold or at least very poorly understood. So people talk about radio frequency as if it's going to shrink wrap the skin. Nothing shrink wraps the skin, but that's what everyone wants. What do I think these devices do? Radio frequency is nothing more than heat at the end of the day.
Yep.
Heat is going to destroy fat cells, which may be a good thing. If you're adding it to a submental liposuction, it will, help further reduce the volume by destroying the fat. And it may help promote some collagen formation because that's what heating tissue does. If it's damaging tissue and causing collagen, but it is not going to shrink wrap the area. So one device in particular that I spent a lot of money on, and the probes are sitting in my basement, advertises itself as something that's you could use it all over the body to tighten the tissues, and it just does not do that. No.
Yeah, I think that for us, we've been using some quote unquote skin tightening treatments. And we do it I do it myself under my neck with the hopes that I don't droop as I get older. I mean, I will at some point. But what I definitely, tell patients, I warn them, especially with the body, there's never been anything that can really tighten up skin of the body, no matter what it is. It has to be invasive, otherwise it's just not going to do it.
It's like hemming a pair of jeans. You have to cut out that tissue and stitch it closed. I mean, as much as I'd love to think that we're doing cutting edge stuff, oh my God, surgery, plastic surgery. A lot of times I tell people, calm down. Look, we're just cutting out tissue and tying it together with little dissolving ropes. That's where we're at in 2024.
I think for me, the device, and honestly, if you got stuff sitting in your basement, do what I did. I just sold, and I'll tell a brand name because this brand pissed me off. I sold my M-Sculpt recently on eBay for, I think I got $12,000 out of it. I sold it on eBay. I bought it, and I told this story on a Hot Topics a couple weeks ago. I paid, I don't remember, my guess is maybe $150,000. So M-Sculpt is basically a muscle stimulating device where you undergo 4 treatments. Each treatment's about a half hour, and their studies show that you can increase the thickness of muscle by about 20%, and you can reduce the thickness of fat by approximately the same amount. And I was always very skeptical until they came out with their 6-month results. And the 6-month results come out and showing that even if they don't have any further treatments, those results stayed, which I thought, wow, that's amazing. If you can get 6 months out of it, then, they do it maybe once every 6 months after that. I think that's pretty reasonable. And so I got the device back in 2019. And then in 2000, so I paid $150,000, something like that. And then in 2020, they come out with M-Sculpt Neo, which basically means new M-Sculpt. And I just spent $150,000 on old M-Sculpt that now patients are calling the office saying, I'm looking for M-Sculpt. Do you have new or old M-Sculpt? So we had to be honest, we have old M-Sculpt.
No,
and
it's
then
classic. You have to call it classic.
Oh, classic.
Yes.
Yeah. And so then they say, well, I don't want to pay what you're asking because it's old technology. And it's like, dude, I just bought this a year ago.
Yeah.
And the company was kind enough to offer to sell me the M-Sculpt Neo. I only had to pay something like $60,000 or something for that. Now I'm going to go and pay even more money to get, it was ridiculous. And so I refused to, we've got a lot of followers on social media, and I refuse to promote it on my social media because they've taken enough money from me.
Yeah.
And so eventually it just wasn't really being used. And I thought, it's just sitting here. I'm just going to get rid of it. And so I sold it to a really nice doc in one of the southern states here. They drove up, picked it up. And
it's funny, but at the and again, not singling that company out, but these companies in general, at the traveling shows, what they do is you get together. There's like 200 people in the audience. They have someone up on stage. They're getting it done. Like, this doesn't hurt at all. They have a ticker on stage showing how much money your practice can make. Everyone's like, oh my God, there's like this hype.
Yeah. And then
you get it.
And the first person who ever had it comes on like, I paid this device off in 3 weeks and I've made $500,000 off it in the last 3 months. Yeah. And it's like, oh, but then 8 other people within a 5-mile radius of your office now have it as well, in which case, it doesn't work that way.
For many of these devices, and I initially started with a fat freezing device.
Yeah.
And for every one that was happy, I would have like 3 that weren't, or 3 that saw nothing, or 3 that saw minimal of anything, squinting at the before and after spending a couple thousand. It's like, so the old adage rings true. If something sounds too good to be true, it probably is.
So if somebody is looking for a good injector, I mean, you've had a lot of great injectors at your conference, but maybe they don't live next to any of them. How do you recommend somebody to choose a good injector or a good plastic surgeon?
That is a really good, a good question.
Do you need to be a doctor to be a good injector? Do you need to be a dermatologist or a plastic surgeon? Or can you see somebody who's a nurse?
Absolutely. A lot of the old school plastic surgeons and dermatologists in particular, they're very angry about what's going on because they had the run of the roost for so many years. But now the nurses in particular, nurses, PAs, NPs, like they do an incredible job, because what do? They throw their entire selves into learning. They're the ones coming to the conferences. My conference, probably 85% non-physicians.
Oh, wow.
These are the ones that are learning and going to the cadaver dissections and going to the teachings. A lot of us surgeons were too cool for school. We're like, oh, we're not going to bother with that. I can inject. Like anything else, you're good at what you put your passions. If that's your passion, if you put the time behind it, you will be better. So I would much rather go to a nurse who's been doing it for 10 years, who's been to a bunch of conferences, versus a plastic surgeon who just once does it, maybe 4 injections a week. Much rather.
So how would they find somebody that would then be a good injector? I mean, is it just all word of mouth? Or?
It's some word of mouth, and a lot of it is social media as well. Mm-hmm. So you have to be super careful because, again, like we've said, it can be very misleading. But I would say follow some injectors, make sure that they are posting honest before and after pictures. And I give lectures about this as well. The lighting has to be the same, the distance. If it is a standardized, everything's the same. Makeup's the same, lighting's the same, and they consistently show beautiful results, and they teach on their Instagram lives, and they credential themselves. That's what I would do. That's how I would find an injector. If you don't have word of mouth to go by, learn from them on social media, and if they vibe with your values, then that would be my best bet.
So we've talked a lot about injections. We talked a bit about surgery today. What is your practice like? Tell us about the patients that you treat in your practice and what a typical week is for Dr. Subbio.
Yeah, I'm backing off on surgery. While I love surgery, I'm not one of these surgeons who wants to be operating 4 days a week or more, not even 3. Like, I found my niche, and whereas before I started out doing faces, noses, ears, breast, body.
Everything.
Now I just do breast and body. I've leaned into that. I think I do a really nice job with that. So that's what I'm sticking with. So my prices have gone up. So I've become more selective. And now I have more time for doing some injectables, but even more so, more educating and stuff like the conference, which is really, it's one of my passions.
Mm-hmm. Have you had any pushback from your local plastic surgeons just with the fame that you've had? Have there been ones that have been jealous? I mean, I know you operate out of places where other plastic surgeons are there.
No, I mean, it's funny. Some of them view me as a curious oddity. Oh, he's on social media, and like he's big on social media. Like, it's been overwhelmingly positive. But again, you do hear grumblings of people who are maybe a little bit jelly. Yeah. But what are you going to do?
Yeah. If anybody ever asks me who they should follow on social media, I always mention Subbio. And you know this, I've given interviews actually for national publications. I'm like, don't follow me, follow Subbio. And I find that the content that you create is so original. You are a true content creator. We were talking earlier about there's a difference between there are doctors who are on social media and there are content creators. And I view myself as a content creator. Like, I create content for people to consume, to either enjoy or learn from it. It's not just all before and afters and stuff. And so I really credit you for being one of the trailblazers as a true content creator, a creative force in the industry. Who else do you follow in the field of medicine? It doesn't even have to be cosmetic medicine, but in general, that you enjoy and maybe you feel inspired by, present company excluded. I don't need you to say, oh, you, but who else do you find that inspires you to help create content?
Well, you don't want me to say it, but I'm going to say it because I'll say this. I did a post a couple weeks back, and you left a comment on there. You are a true content creator. And that, I'm like, coming from Tony Youn, that means a lot to me because I value in the same regard. Like, you're an artiste when it comes to social media and beyond. So you're creative, and so you, of course, it's funny. Like, I tend to look outside our field for creative inspiration. Yeah. I am wowed by the greats at surgery. So, facelifts, Mike Nyack or Ben Tale, et cetera, oculoplastics like Flora Levin. Like, I could name that. That's who I follow in the field because I think they're brilliant at what they do. Yeah. When it comes to content creation, I find that there's not many of us in the field, and I think that's why we stand out. So that's why if you look at who I follow on my own page, it's lots of funny pages. These content, King Bach and stuff like these. All these people that make really funny, interesting, creative videos. I tend to look outside our industry for inspiration.
So who are some of those that you follow outside that you really enjoy?
Oh, I'm going to blank. On the spot, I can't even I can't come up with them right now.
Okay.
I'm so sorry.
That's okay. Yeah, maybe if we think of some, we'll add it to the podcast.
You could go to my page and see who I follow, and then it's a smattering. It's all over. There's some philosophy pages, some comedy pages, some on stoicism, some on critical thinking, all over. I like variety more than anything else.
So you are a true artist. I was an artist back in the day. I did some oil painting. I did some cartoons, and I collected comics back in the day.
That's what I wanted to be.
But who then is your favorite actual artist?
I mean, I would say this is so cliche, so I wish I had a cooler response, but I love Salvador Dali.
Okay.
And so I wish I had some cooler, trendier, a little bit deeper cut.
He was a little odd.
He's a weirdo.
Yeah.
And I love
kind of strange
weirdos.
Yeah.
People who like at the time, especially when was he around? The 20s and 30s? His stuff was just like bizarre and strange and thought-provoking. I am partial to the weirdos of the world, be it music or art or TV. Like, I love weird things.
And his art, as he got older, got really, really out there.
Yeah.
I used to have it was a poster when I was in college of one of his, and it was the Ecumenical Council, I think was the name of it. And it was just out there. But the artistry was so great. It had all these religious undertones, and it was a ton of detail, which in some of his earlier works, the more famous stuff, you don't see as much. But as he got older, I felt that he added so much more detail, and there was so much more to see in a lot of it.
I mean, it's funny, like my son, my 6-year-old son, he's learning about artists in school, and he's right now, again, this is a very popular art. He's big into Vincent van Gogh, and we're going to go next week. We're going to New York City. We're going to go MoMA and check out Sunflowers. He's going to love it. But I love the story of Vincent van Gogh as well. In that, like, he's brilliant, tortured figure who never sold one painting in his entire life. And so when I give these conferences, especially about creating content, I say to people, we have such an amazing gift and opportunity. You can make a post, and you have, which has reached 20, 30 million people. Anyone can go viral. It doesn't need to be in the millions. You can make a post, and you can see 4,000 people, 10,000 people. One of the most famous artists to ever exist died by suicide after a life of failure. Yeah. And he didn't have these opportunities that we have in the palm of our hands to create art and send it out to people. So I get goosebumps talking about the opportunity we have to do that.
What are the next steps for Subbio? Where would you like to see yourself 5 years from now?
Just focusing more on creative pursuits, and like I'd like to be operating 1 day a week, injecting 1 day a week, and spending the remainder of my week just creating content. Maybe one day making a pilot that will do nothing, but I could a TV show.
Maybe you'll do something.
I want more time for creativity. That's what I would love to do.
So how can people find Dr. Subbio? Your Instagram account, is that really the main place that people should go to?
I think so. Yeah, I'm not big on really. I've tried it's my passion. I've kind of leaned, unlike you, who's been able to succeed in multiple ventures. I'm kind of a one-trick pony. So Instagram would be Dr. Subbio, dr.subbio, Subbio.
So you've got to follow Dr. Subbio on Instagram. Like I said, if you follow one plastic surgeon on Instagram, other than me, I would recommend that you follow Dr. Subbio, because I agree with you. I think that there are only a handful of us really in all of cosmetic medicine who are true content creators. We're creating content not just to educate, but to also entertain, and trying to put actual, work behind it. So it's not just talking into a phone and posting it. It's editing, it's producing, it's doing effects, and for you, using your art. So I really, really encourage you, if you've enjoyed this podcast, definitely follow Subbio. He's no question worth the follow. But if you're easily offended, then maybe don't follow him, because he definitely will put stuff out there. Thank you so much for joining me. This has been a lot of fun.
I really enjoyed the conversation, and it's high praise coming from you. I have the utmost respect for everything you do. So thank you.
Well, thank you. Well, thank you so much for watching and listening. This is the Dr. Youn podcast. If you have been enjoying this podcast, if you could leave a rating or review on iTunes or Spotify or wherever you get your podcasts, it definitely helps me spread the word. And as always, remember to eat real food, use clean skincare, and auto-juvenate before you operate.